Sharon. Oh, shout out to the members of Alpha Kappa Alpha Sorority Incorporated who are in Houston at our 68th Boulay. I so hate that I'm not there with my sorority sisters, the first and the finest. But I'll be in Philly. So shout out to the members of Alpha Kappa Alpha. We're having our annual, or our biannual Boulay. So there are a whole bunch of pink and green all over the city, but more importantly, wherever Alpha Kappa Alpha goes, we make an impact. So, good morning, everybody on this Facebook Live. This is something cute we're doing. In one of my books, Is That Fried Chicken Wing Worth It? Not a Diet, a Mindset. You can still get it. As a matter of fact, if you tell me I want it, the first 5 people that will inbox me, you will get it within the next month free. I'm not going to repeat that again because I just came up with it and my staff is going to kill me. But anyway, today we're going to talk about what doctors want you to know but may not tell you, and that, if you have the book, is on page 162. Now, I keep telling y'all to be honest with your doctors when you go to your appointment. There is a no judgment zone. Nobody cares what you do, how you do it. There's no judgment. When diabetics say, I haven't eaten any carbohydrates, whatever, you just get the blood work and you know you're lying. So just tell the truth. All right? So, I am going to be with my visual aid. This is a prop. It's not really that I wear glasses. It's really a prop to make me look, like I'm smart. Yeah, okay. So, but at the same time, I have doctors that are on a private page on Facebook that are chiming in. So I have what I said in this book years ago, and because I did a national survey of about 1,000 doctors and said, I asked doctors from all over the country to tell me what they would tell you, the patient, if they could be open and honest. I promised that I would keep the comments confidential upon request, and here's what they had to say. Some are funny, some are real. So this is a question. If you could tell a patient one thing openly and honestly about their health, clinical or not, what it would be? So number one, out of, is that fried chicken wing worth it? Stop lying. You and I know that you are not exercising and that you're eating everything but the kitchen sink. It's not water weight, it's fat, baby. And it said, and this is from a doctor sign, I'm fat too, MD. So now, let me tell you, this is one of the most popular ones. What doctors want you to know but may not tell you, please don't think that the few hours you have spent on the internet researching your subject of choice can compare to my knowledge base acquired through 4 years of medical school and 3 years of pediatric residency and 11 years of pediatric clinical experience. If everything you needed to know could be learned on the internet, then why do we still have medical school and licensing board exams and continuing medical education? I got you, Tammy Ford. Tammy Ford says she wants the book. Inbox me your address. I got you. Medical knowledge is not stagnant. Keeping up with it as well as knowing to apply new information. And then this doc, she's Dr. V, or he is Dr. V, a pediatrician. But then he says, I appreciate parents that are genuinely and passionately concerned about their children's well-being, since most parents are not. I also appreciate a parent that comes in ready and focused to discuss important and difficult issues, but let's be in partnership. Oh, and by the way, bathe yourself and your kids before your appointment. Hygiene is not optional. That's what the doc said, a pediatrician. This is what a North Carolina MD said. She said, or he said, what part of no do you not understand? The N or the O to all of my drug seekers. Doctors are people too. Now, let me tell you what the docs are saying right now online. Dr. Kendrick Weaver, who is one of the baddest dermatologists on the planet and in Virginia, go see Dr. Kendrick Weaver and like her webpage. Kenesha Kendrick Weaver said sunscreen use daily prevents the signs of aging. I've been talking about sunscreen forever. She is a dermatologist that's a bad girl. One of my people. So Dr. Kindred Weaver, check her out. Now, this is what an OBGYN just said. Your vagina is normal and smells fine. It's supposed to smell like a vagina, not moonlight path. Ooh, Dr. Mayo, okay. Now that's funny right there. What is moonlight path? Okay. This is what, oh, wonderful, a pathologist said. Pathology is more than autopsies, not usually made for TV dramas that can be solved. And, oh, Melly Bell, you got it? That was a good one, Dr. Bell. Pathology is more than autopsies, not usually made for TV dramas that can be solved in 32 minutes. My docs are saying, yo, we got hundreds of thousands of dollars worth of student loans. We do know a little bit what we're talking about. Okay, let me tell you what else they said. Oh, this is another OBGYN. She says vaginal discharge is normal if it's clear or white, no itching, burning, or foul odor. It is fine. And she put it, period, is, period, fine, period. Stop obsessing about your damn vagina. I'm just reading what my OBGYN said. Doctors are people too. Yes, we may say the little curse words. It's all right. So, Dr. Melly Mel, who told us our vajayjay not supposed to smell like moonlight path. That's a Bath and Body Works scent. All right. Another doc says, tell the physician the important thing first, not after the visit. Don't be coming to a visit. You have 20 minutes, and then you say, oh, by the way, I had chest pain. You call back and want to call back. I'm just saying. I'm just giving a shout out. So this is Dr. Sharon Live telling you what doctors want you to know, but they may not tell you. And then I have doctors right now streaming online telling us stuff. And then, of course, in my book, Is That Fried Chicken Wing Worth It? I surveyed 1,000 doctors. But the docs that are online right now, they say they want you to know some stuff. Woo! Oh, Lord. Okay, so this is a fire safety tip. If a pot of grease catches on fire, turn off the heat. Cover the pot and leave it alone. Don't pick it up. That probably is an ER physician trying to tell you that. That's what I'm just saying. That's probably an ER physician. All right, keep it covered. So my docs are telling us stuff. And if you are watching me live and you're a doctor, go ahead and just put it on live if you got something else to say. I think the moment of the day is, Dr. Melly Mel, your vagina is normal and smells fine. It is supposed to smell like a vagina, not moonlight pad. Okay, so now, other things. Now, I'm going to tell you what the number one thing the doctor said when I surveyed 1,000 doctors. What they said, number one, I'm just reading what they said. They said, take a bath. Don't bring your funky butt up in the doctor's office talking about it's time for a pap smear and you have not taken a bath, or you coming from the gym and you didn't take a time to take a little bath. That's what they said. Oh, this is what one of them said. Don't stop me in the grocery store and at the mall and go into details about your health. I am trying to enjoy my 1 or 2 days off, and I'll smile, but I'm really getting pissed off, especially if I'm with my family. Respect my time. Signed, I have a life, MD. Oh, Lord, here's another doc, what the doc said. Don't give me a sob story about not having your $25 copay when you drive a car that is newer than mine and you come into my office wearing Ferragamo shoes. It's an insult to me, my profession, and my office. Tired doc. That's key. You actually, and doctors have said this, you have no idea what the current climate in medicine is. Doctors are under fire. The healthcare profession is under fire. You have many OBGYNs that pay 6 figures for medical malpractice, right? And so especially if you find a doctor that is still in private practice, you have found a great thing, because we that ain't happening right now a lot. And so when you're crying about $25, but you have the $35 manicure and the little flower that's $5, and then you want to be mad about a $25 copay. Baby, you picked your plan. You picked it. Okay, so this is Dr. Sharon talking about what doctors want you to know but may not tell you. I got on my props. Hi, Onyx. I want you, Onyx, make sure, and number one, just a sidebar, I want to just plug, Onyx, please put your flyer up. One of the greatest events in Maryland, a jazz festival, was put on by one of my boys, Onyx. Please put the dates up and go put your sunscreen on, as Dr. Kendrick Weaver said, to prevent aging. But go to this wonderful 2 or 3 day jazz fest. It's just blown up. So, okay. So let me tell you what else doctors want you to know, but may not tell you. Because I have, okay. Dr. Welch, I hope you don't mind me saying your name. Dr. Welch says every pelvic exam is not a pap smear. She said it's a pelvic exam, and a pelvic exam is just looking at the pelvis of a female in the vajayjay. And if you don't have a uterus, you still need a pelvic exam. So go ahead. And Dr. Welch done told y'all the vaginal discharge is normal. I love my OBGYN. They on it this morning. So now, this is key, because doctors talk about this a lot. If I write a prescription or order a test and your insurance company denies it, yell at them, not at my staff, and certainly not me. If I write the order, why would I deny it? This is key. And this is signed Fed Up MD. That's the Southern Maryland Wine, Jazz, R&B, and Funk Festival. Go to vendor-nation.com. That's the festival I was talking about. Onyx, I'm trying to dip back in this year. So, this is for my brothers out here. This is what one of the urologists said. Brothers, y'all on? Onyx is on. Any other brothers on? Okay. This is so much fun. What doctors want you to know but may not tell you. Viagra is not the cure for being a bad lover. It doesn't make you last longer, and it doesn't make your penis grow. You also probably don't need it before age 50, and certainly not at 25 years old with no other medical conditions. If I say no, that is what I really mean. Signed, an internist. So that wasn't a urologist. So you asking for Viagra, Cialis, Levitra, any of the erectile dysfunction drugs at 22, baby, your penis ain't gonna grow and you ain't gonna be bigger. All right? I'm just saying, and you ain't gonna last longer. If you're a minute man, you need to do some other stuff. I'm just saying, I'm just saying what the doctor said. Okay, so now, what else do doctors say? And again, I have live online doctors chiming in. Y'all keep chiming in. And then I have information from my book, Is This Fried Chicken Wing Worth It? Not a Diet, a Mindset. So, okay. Dr. H from Brooklyn, New York says, take care of yourself so that you can take care of others. You all know that I'm all about self-care. And even when I don't practice what I preach, it really is take care of yourself. Oh, this is what one doctor said. I think she's pretty smart. She's smart. She's an internist and geriatrician, and she's a health strategist. And she says it even looks good. Healthcare reform begins with you. You can have access to the best healthcare in the world, but if you don't take care of your body, eat right, exercise, and follow your doctor's instructions, then what's the purpose? What is your health worth? That's what Dr. Sharon Allison said in her own book. For what doctors want you to know. Oh, I see you, Dr. Hampton. Tell us something. One of the baddest, this is one of my babies, one of my mentees, one woman that I really respect, one of the baddest breast surgeons in the nation. She's a bad girl, Dr. Regina Hampton. Go on and tell us something that you want us to know. Okay. Oh, this is what a primary care physician. We are not rich. And if we are, it is not from patient care. Your little $10. All right, I'm just saying. I'm talking about what doctors want you to know. Now, this is what a doctor said. I showed them a video of mania so they could all stop saying they're bipolar. Oh, and maybe tardive dyskinesia so they can stop malingering for antipsychotics. Now let me break this down. This doctor said, and I don't know if she's on, so tell me if I can say your name, that y'all need to stop self-diagnosing yourself with bipolar disease. You just a mean heifer, right? Okay, so anyway, I believe this is probably a psychologist saying, stop saying they're bipolar, and then they come in acting out symptoms because you done saw something on the internet so you can get some drugs, but your symptoms don't add up. That's what the doctor's saying. I'm just saying. Okay. Oh, this is one doctor, what they said, and this is perfect for this morning. She or he says, every day I begin with prayer in my office for you. Every night I end my day in prayer for you and your families. I would hope that you would remember me in your prayers. I believe that being a physician is a calling from God, and although I may not openly talk about it, I ask for his guidance. Some doctors are Christians too. Signed, Justin Instrument, MD. And that really is important. And I do, I have, of course, friends. I'm a physician, but I have friends all over the nation. I have my girls. I have my guys or whatever. And I have to tell you from a real standpoint, suicide among professionals is rampant in physicians. We know, and we have private pages on Facebook and we share. But I know at least 4 physicians in 2018 that have committed suicide. So do pray for your doctors, pray for your healthcare team. It is very stressful every single day to listen to a problem and to come up with a solution. Sometimes get it right, sometimes not. Or if, a patient you love dies, you grieve that. And you're dealing with your own families. Doctors have the highest rates of divorce, especially doctor-doctor marriages. And you have made sacrifices for years. And this is not a pity party for doctors, because doctors, we do all right. All right. But do pray for them. So now, these doctors are coming in. So I'm using things that I put in my last book, one of my last books. But this is what a doctor says. Do your Kegel exercises as much as possible. Kegels, I done taught y'all how to do Kegels. That's when you squeeze like you gotta go to the bathroom to keep your vagina tight. You will not have a sex drive if you are not sleeping or if you don't have a partner. I can't help with all those things. You will not have sex if you are not sleeping or you don't like your partner. If you're not sleeping well or you don't like your partner. She said, okay, my OBGYNs ain't playing. Okay, here comes another doctor. Don't punch windows, doors, or people. Your hand always loses, and you will lose time, money off work due to injury. It's not worth it. This is a great one from Dr. Wilkins. NPO, which means nothing by mouth, is guidelines were created for a reason. If I tell you to be NPO, then you need to not have anything. Well, she must be a surgeon. You must not have anything by water or mouth, according to the timeline. Please follow them accordingly. All right. My doctors are still chiming in. Here's another one. This is simple. We can all do this. Y'all can email your doctor right now or text them or call the office. Instead of complaining about something, say this. And this is how I ended this part of the book. It said, a thank you would be nice. Signed, Unappreciated MD. Again, I'm Dr. Sharon Allison. I am talking about what doctors want you to know but may not tell you. I put this in one of my books. I surveyed over 1,000 doctors. Over 1,000. And I said, if you could tell a patient one thing openly and honestly about their health, clinical or not, what would it be? And so I also right now have doctors online that are chiming in on a private Facebook page. Hopefully they're chiming in here. If you are a doctor watching this, do go ahead and tell us something that you want patients to know. I'm telling them now, loving this. Okay, so now this is something else that doctors want you to know but may not tell you. This is key. I talked about this last Facebook Live. This is the biggest lie before God. I don't make any more money from writing you a prescription or ordering a test. I really do have your best interests at heart. Respect me as a professional that I am, and I will respect you as the patient that you are. That is a family medicine doctor. This is one of my sheroes and one of the baddest dermatologists, a pioneer, actually had her own skincare line and all of that. Dr. Susan Taylor, who came in, and she is the founder and CEO of RX for Brown Skin. Susan Taylor is a bad girl out of Philadelphia and teaches international dermatology. Despite what you think, you are the one who is in charge of your health and your health care. It is not your doctor or your mother, father, sister, brother, spouse, son, or daughter. You are the one who is in control. So there are 4 critical things that you have to do. Go ahead, Dr. Taylor. Number 1, first, know your medications that you are currently taking and the medications that you are allergic to. Just write them down and keep them in your wallet with your driver's license. Second, know the names and telephone numbers of all of your doctors. Third, write a list of your medical problems and previous surgeries. Guess where you will keep it? Yes, your wallet. Fourth and finally, keep your health insurance and prescription cards in your wallet. So being in control of your health is as easy as 1, 2, 3, 4. That's Dr. Susan Taylor. Any doctor worth their salt, white, black, pink, green, brown, whatever, knows that one of the baddest women in medicine as far as dermatology is concerned is my girl, Dr. Susan Taylor out of Philly. Hope to see you this summer. So now, here's another tip that's coming in online. Occasional bilateral breast pain is normal and part of being a woman. That's key. That's key. And I saw Dr. Hampton on earlier. Breast pain is normal and part of being a woman. That's by a doc that's chiming in right now online. Okay, thank you to my doctors chiming in. So now, this is a good one. This is from the book. Ooh, oh Lord, this is a gay OBGYN. This is what he's telling y'all. I am not, nor will I ever be sexually attracted to you. Do not come on to me in my office and don't always ask for a breast or pelvic exam. You don't need them every 6 months. And he signed gay male OBGYN. And I think this is beyond gay male or whatever. I think this is just a male doctor. You don't need a breast exam every month. And the other part is, this is key, we don't really sexualize you when you come in the office. When I was in residency training, there was a guy that would come in all the time. He was a little off. He would come in all the time, and literally he wanted a prostate exam all the time. He was diabetic, so I would see him like every 3 months. For real, this ain't no joke. Every 3 months. And then, I always been Dr. Sharon, I'm a little off. I'm a little special. And I would go in and he would say, I need my prostate exam. I said, no, I just gave you a prostate. You don't need a prostate exam. I'm having some pain. And he would literally drop his pants. One day I just wasn't feeling Jesus too good and I wasn't nice. And I said, if you don't put your pants back on. I don't want to see your butt. I don't want to see nothing else. I'm serious. I really did do that. All right. So now I was in residency. All right. Okay. So this is what a pediatrician says. Raise your kids right so they don't tear up my office. You may think that little Johnny's temper tantrum is cute, but it's not. He's in training to be a terrorist. I'm sorry, that's what the doctor said. That's what a pediatrician said. Little Johnny is training to be a terrorist. Okay, emergency room doctor, this is what they said. This is very, very important. Wear a seatbelt every time you get in the car and don't drive drunk or even a little tipsy. That's from an ER physician that's trying to tell us that they get tired of seeing accidents, deaths, and all of that from not wearing a simple seatbelt. This is very near and dear to my heart. One of my relatives actually was killed, who I love so very much, and a seatbelt would have saved her life. So, now a psychiatrist. A psychiatrist is a specialist for the brain. Y'all know y'all got to share this one. This is a good Facebook Live, right? Holla at me, Kimberly Cook. What's up? Love you. You know this is a good one. All right. So now this is what doctors want you to know but may not tell you. I'm Dr. Sharon Allison. Follow me on Facebook. Beautiful Woman Inside Out. Cards by Dr. Sharon. Twitter. All that. So now let's go. This is what I do have doctors chiming in online on a private page telling you stuff up to date. I'm reading out of one of my books, but this is key. If you don't cancel your... Hi, Dr. Octavia Cannon. Dr. Octavia Cannon is one of my best friends in the world, one of the leading OBGYNs in the country, president of ACOOG, and I post about her all the time. Dr. Cannon, go ahead and chime in and tell us something that you want patients to know. That you has an OBGYN. Don't tell them our stuff that we talk about offline and laugh about. Just tell them something that you want them to know. Okay, so now, as she gets that together, a psychiatrist says, if you don't cancel your hotel reservation, you will get charged for a night stay. Why complain? I have signs all over the office telling you that there's a fee for missed appointments. Just call and tell us you're not coming in time. Call us and tell us you're not coming in time. And if you don't, and then this psychiatrist put in caps, pay the fee. Boom, I'm just saying. Oh, this, I don't know what their specialty is, but they wrote, no matter what your husband says, you cannot get gonorrhea from a toilet seat. He's lying and you're stupid to believe him. That's what this doctor, I love my job, MD, said I want you to know. Woo, here's what a doctor online saying right now. Woo, doc. Woo, Lord. I ain't gonna say your name because you ain't tell me I could say your name. But 1 to 2 chief complaints at max when you coming in for a visit. We'll just not have time to appropriately address 650, 1,100 complaints at your appointment slot. Make another appointment and follow up. This is what doctors want you to know, but may not tell you. This is one of the funnest Facebook Lives that I have done. I'm just saying. Okay. Oh. This is what a family doc wants you to know. You are what you eat. Junk in equals junk out for you and your kids. Family doc. Lord, Dr. K said, being mean and nasty to my staff gets you nowhere. Respect them, tell me there's a problem, and don't treat them like dirt. They are your direct connection to me. Tell me if there's a problem, and I will handle my staff. Dr. K. Woo! Oh, this is what an internist, I have a special love for internists. I'm an internist and geriatrician by training. Whew, this is good stuff. This is what docs, again, they smiling, but they want you to know some of this stuff. Okay. Oh, before I do what the intern said, again, for you all just tuning on, I have, in my book, I surveyed 1,000 doctors and asked them, what do you want patients to know, clinical or not? And you may not tell them, all right? And so I also have online on a private page that we have on Facebook, I've asked doctors from all over the country, hey, I'm on Facebook Live. Tell me what you would tell a patient. And one doctor says, Dr. C. DeGranges, DesGranges, I'm sure she doesn't mind. Dr. Tracy Paul DesGranges says, please stop smoking, period. End of story. Every doctor in America will tell you that. Just stop smoking. Period. Okay? All right. So now this is what an internal medicine doc said. Don't threaten me with a lawsuit when I don't do what you ask me to do. I am not a vending machine. I am a professional and will give you the best care that I can. This is not a drive-through restaurant wherein you study the menu at home and then come in demanding prescriptions, tests, or whatever. Let's have a discussion. And just like you decide what you will do, I will decide what I professionally think is right. If you can't agree with that and that premise, please find another doctor. You're not going to hurt my feelings. Signed, Internal Medicine. Again, doctors are not vending machines. And I just want to do a sidebar. So to become a doctor, you have to go to high school, 12 years. Some graduate early, but 12 years. Then you got to go to college, 4 years. Then you have to go to medical school, typically 4 or 5 years. Many doctors are now MDs and PhDs, so that's a 6-year process. Then you have to do residency you have to do a year of training right after medical school. I forgot because it's been a minute, but you do residency training. And so then that's usually 3 years to up to 5 years. And then many of us have done fellowships. I did a fellowship in geriatric medicine. That's another 2 years. And you want to look on the internet and tell an OBGYN who's been in school since Jesus was born, how to do a pap smear. I'm just saying, I think you should be engaged, because that's one thing that I teach. I teach people to be engaged in their health care, but also have a discussion and also get a second opinion. Oh, by the way, doctors will tell you getting a second opinion does not at all, it's not an insult at all. So please get a second opinion and let your doctor know you got a second opinion. Because guess what? If you have a complicated case, they're on the phone calling somebody, girl, what's going on here? This is what's happening. Can you please tell me what you think? All right. So now let's get to another doctor. They done came in hard. Okay. This is an OBGYN, Dr. Christine, that says ovarian cysts are part of the normal reproductive cycle. A family history of ovarian cysts, which are cysts in the ovary, is normal. So it's, you're supposed to have some cysts, but they're not supposed to be so big they pop and then you have problems. All right. So now, and what is a cyst? A cyst is an empty, usually fluid-filled sac. You can have a cyst on your face, a cyst anywhere on your body. To have them in your ovaries, that is normal. Go ahead, OBGYN. Now, I'm going to tell you what's really getting on doctors online. Y'all must be going into the doctor's office asking a whole bunch of questions in your 20-minute time slot. Just make another appointment. Okay, your physical appointment isn't a time for your laundry list. You will be charged for that separately, and we likely don't have time. Me asking you to make another appointment isn't because I'm money hungry. It is so I have time to appropriately address your concerns 2 to 3 at a time. Yes, I need to know all of your meds. This is what she goes on to say. I need to know all your meds, whether they're from another doctor, whether they're vitamins or supplements, whether you bought them online, bought them in from another country. Go ahead, Dr. Katrina. It matters. Again, I'm Dr. Sharon Allison. I'm doing a Facebook Live on what doctors want you to know but may not tell you. I have doctors online on a private page chiming in with some good stuff. And then I'm coming from one of my books, Is That Fried Chicken Wing Worth It? Not a Diet, a Mindset, wherein I surveyed 1,000 doctors and asked them, what would you want a patient to know that you may or may not tell them openly? Because sometimes, you got to be nice and all that, but they really, I love, because I want to be nice again, because I just love when the doctor said, and I will repeat it, every day I began with prayer in my office for you. Every night I end my day in prayer for you and your families. I would hope that you remember me in your prayers. And I read this earlier, and he says, some doctors are Christians too. I'm just an instrument of God. So now, this is what another doctor said. Please be on time for your appointment. Don't assume that I'm going to be late. On the other hand, if I'm running late, it is usually because I'm giving more care to someone in need. I'm not just watching television. If you understand that, then when it's your time and you need more time, maybe the next person will understand. I am committed to my patients, not the clock on the wall. And they signed this, I do care, MD. Now, what did the diabetic doctor say? They said, diabetes doc, this is what they said. Don't starve yourself the day before you come into the office in an effort to try to get your sugar and glucose level down and then lie to me basically about what you're eating. The hemoglobin A1C tells me what I need, what you've been doing for the last 3 months. It's not about getting the numbers right for me. It's about your health. Whew, that's good. All right. This is what another doctor said. A dermatologist with a conscience. She says, Get your priorities right. You have no problem paying for Botox. But when I tell you that you need to have a biopsy on a mole, you want to know how much your insurance will cover and if it's necessary. Seriously, a biopsy for cancer or a cosmetic intervention, seriously, you need to think about that. And that is a dermatologist with a conscience. Again, I am telling you what doctors, oh yeah, I love this one, what doctors want you to know but may not tell you. I hope that you all repost this because this has been a hoot, but also real talk from real doctors. I have them online chiming in, as well as I have a survey that I did nationally. I need to hurry up and get off here. Okay, let's see what time it is. So this is what a human MD said. They signed a human MD. Doctors are human and we make mistakes. Just because I made a mistake and didn't diagnose you the first minute that I saw you doesn't mean that I'm a bad doctor. Don't tell everybody what I did wrong unless you will allow me to tell them what you did wrong and the details of your history. We're both human. I try my best and I'm darn good at what I do. This is what a human MD said. And I know, yes, there are some crazy doctors. There are doctors that don't care. But I'm telling you, I know thousands of doctors. And most really, really care about your health. Okay, this is a little funny. I'm sorry. This is what one doctor, he signed it or she signed it. I don't know if it's men or women. I'm reading this one from my book. Broke MD, BROKE, Broke MD. Quote, pay me without me having to send you over to the collections department. If your insurance company or whomever sends you a check for my care, then pay me. You pay everyone else. Why not the office that takes care of your health? If you can't pay it all, pay something and don't get mad when my staff asks you about paying me. Okay, so now, the office doesn't run off love. We have to pay rent, staff, water, lights, other bills, and my kids need to eat too. I sacrifice to be in private practice. Just pay it. Don't make me send you to collections. Call Broke MD. Here's what a doctor online is saying right now. Please treat that baby's attention deficit ADHD. Hyperactivity disorder. I'm getting all crazy. Okay, ADHD. That can save his or her career and life. Please treat ADHD. That I know is from a pediatrician. Okay? So now, I hope this is helping somebody. Hey, cuz. Hey, April. I hope this is helping y'all. This is what doctors want you to know, but may not tell you. All right? So now, okay, we done got a couple of people talking about cheating. Y'all must be going into the doctor's office. Once somebody said you can't get gonorrhea off the seat no matter what your husband say to you. What y'all telling the doctor? I'm just saying. All right, okay. So this is what they said. Don't ask me if your husband or wife is cheating. Ask them. And no, I cannot give you a copy of their medical records without their consent. Chicago doc, don't ask me that. Okay, all right. So I'm going to wind this up. This is so good. I forgot what some of the doctors said, and the doctors online, they going in. They going in. They want y'all to know some stuff. This is key. Woo! This is signed, Doctor. What do you think this is? This is key. Don't call and ask for a back-to-work slip if you've missed your last 3 appointments. Have a balance and haven't been seen in the office in 2 years. Don't bother with that call unless it's to make an appointment. That's what the doctor, what do you think this is? Now, I love geriatrics because, I'm an internist and geriatrician by training. This is what a geriatrician said. Take care of your parents as they get older. They took care of you, and now it's time. It's their time. Be patient and don't be mean to them. What happens when your kids treat you bad? Take care of our elderly. That's what they want you to know. Okay, so now I'm going to do like 2 more, and then I'm going to let y'all go on with your day. Has this been helpful to y'all? I done got a whole bunch of waves and likes. I'm going to repost this. Y'all got to repost this on your pages. What doctors want you to know, but may not tell you. Y'all done got some doctors upset. Somebody ain't paying their copay. I'm just saying. And then you go into the office with 50,000 questions. All right. Oh, the emergency room doc. Emergency room doc says the emergency department room is for, and they put in caps, emergencies. Don't come in with the ingrown toenail and then get mad when you have to wait for 4 hours to be seen. That's signed the ER doc. It's for emergencies. Oh, okay. This is what another doctor said. I'm sorry. A pill is a medicine. Whether I prescribe it or you buy it at a health food store or from your cousin out the back of their car. Tell me what you are taking. I won't judge you. I'm just trying to keep you healthy. And this is signed a doctor that believes in holistic medicine, but not craziness. All right. So now, this is another doctor who said, yeah, this is what another doctor said. I'm sorry. Oh, okay. Oh, okay. I'm going to go online to the doctors online. Your period is supposed to come on about every 28 days, give or take. Not on the 7th day of every month. That is key. That's some good medical advice. It is days, not on the 7th. So don't call the doctor's office when your period ain't came on. Oh, is that my girl, LaDonna? LaDonna work in the doctor's office. So again, this is what doctors want you to know, but may not tell you. So again, a great OBGYN is saying your period is supposed to come on every 28 days, give or take, not the 7th of every month. We need to teach our girls that. So if it's not there on the 7th and it's February, was the month before, it's not supposed to be on the 7th. It's every 28 days, give or take a few days. Okay, so let me tell you the number one. I'll say it again because literally, I did a survey of over 1,000 doctors, and literally over 15% of them said this. That's what they want you to know, but may not tell you. Take a bath. That's what many of them said. Okay, so now I'm going to wrap this up, I promise y'all, but this is some good stuff, right? This is some good stuff. They going in. I'm going to have to do this again. So this is what I said, don't take no pills and tell everybody what your pills are and that stuff. And then, we have this opioid crisis right now. And I want to just repeat what the NC North Carolina doctor said. What part of no do you not understand? The N or the O to all of my drug seekers. All right. We done told you to take care of your parents. We done told you to respect the office staff. We done told you to be honest when you come into the office. It's a no judgment zone. Don't starve yourself and all that you make mistakes and your bad kids tearing up the doctor's office. Ain't nobody trying to have time for that. Little Johnny's temper tantrum. That doctor said, the pediatrician said, little Johnny's temper tantrum. You training a terrorist. That was hilarious. All right, so now. And you can't get gonorrhea from the seat was pretty good. Oh, this is really good. I really do care about you, my patient, but I need for you to care about me as a professional. I do have a life outside of medicine, and although I am on call after hours, it really is for urgent issues. Don't call me to talk about a cold at 11 p.m. when you could have come in the office on the day of or wait until the next morning. It really is inconsiderate, and my family suffers enough with me not being here. That's family medicine. Go ahead. All right, so that's it from my book. Again, is that fried chicken wing worth it? Not a diet of mindset. I did survey 1,000 doctors and asked them what they would want you to know and may not tell you. Doctors are going in online with lots and lots and lots and lots, and I do mean lots of comments. I think one of the highlights is let you just know that the vajayjay is supposed to smell like a I'm gonna use that. I'm on live right now. The vajayjay is supposed to smell like a vagina, not Moonlight Path. That was one of the best. silly. I didn't know what bootleg pants was. That's something from whatever. So, okay. I have had a good time this morning. I've stayed on longer than I want. I hope you all really enjoyed it. But I also hope, and we did a lot of humor, but I actually did, tell the physician the most important thing first, not after the visit, and then 3 other family physicians chimed in on and said, by the way, this is the biggest problem in family medicine. Tell me what's going on first so I can deal it. Oh, on the dental side, go ahead. The dentist say, please brush them teeth and floss before your appointment. Thank you for telling me to floss before I hate flossing. So, yeah, I brush real good, but that's a good one, Kimberly Cook. Thank you for that. Okay. I'm trying to see what my other doctors are saying right now. But again, this has been Dr. Sharon Allison Facebook Live. We're going to have to do this again. What doctors want you to know, but may not tell you. I surveyed over 1,000 doctors anonymously. They could have been anonymous unless they chose to reveal themselves. And this is what they said they want you to know. And then I have some baddest doctors on the planet online right now that have chimed in. I got up early and said, hey, y'all, I'm doing Facebook Live. I want y'all to tell me what you want patients to know. And they are chiming in. We got a whole discussion over here on this Facebook page about what they want their patients to know and may not tell you. But in all seriousness, I hope that you heard not just the ones where doctors are complaining about copay or drugs, but you heard the doctors that said, we really care about you. And doctors don't get paid more for writing a prescription. Know your medication. It's about partnership in your healthcare. The reason I do Facebook Live, the reason why I do a lot of talks and a lot of stuff, the reason I write books, the reason why I do a lot is because I want patients to really be empowered and know that they're in partnership with their health. And I will end it with this, what I want you to know. Hi, Dr. Warren Jones. One of the greatest family physicians and health policy experts in the country, one of my guys. Hi, Dr. Warren Jones. I'm talking about what doctors want you to know, what want patients to know, but may not tell you. And then you have LaDonna McNeely, one of my girls that said everything you said is true about family. Patients coming into the office is true. She works at office, so I know she get tired of them phone calls at 5 o'clock. With an emergency and she trying to go home to her family and you could have called early. I'm just saying, let's just be considerate. You know, you want to get off at 5. I'm just saying. And then my cousin, do it again, offer some information and funny too. My cousin April, you know I'm a little cray-cray. You done known me since forever. So, but on a serious note, what doctors want you to know, and I dare say healthcare professionals want you to know, but may not tell you. This has been a great Facebook Live. Do me a favor. Repost this on your site. I am putting it on the and go to like Beautiful Woman Inside and Out, that Facebook page, and Cards by Dr. Sharon. Those are my other Facebook pages. Hey, Kevin Fauntleroy, what's up? For my men, I had some tips in there from doctors talking about Viagra, Cialis, and Levitra, trying to tell y'all, don't be asking for that if you don't need it. And I do have the doctors online. I'm just doing one last little look at my doctors online that are chiming in and telling us everything we need to know. Another doc just came in. She's an OBGYN. She says, don't believe the propaganda about getting a labor epidural that is unnatural. You still have to push that baby out. You are not less of a woman for wanting pain control. Now, you know, we're doing some weird stuff with having babies. This is 2018. I done seen people in the water. If you do that, that's fine. In the water, you don't want to have pain. Man, I'm going to tell you. You push out a 12-pound baby out of a hole this big, maybe this, you a bad girl. Epidural or not. These big head babies, I'm just saying. You love the top. Kevin, you love the top. Alpha Kappa Alpha Sorority Incorporated. Shout out to my sorors that are in Houston at the Boule right now. Okay, I'm going to give you 2 more tips. I have doctors right now chiming in. Dr. Wilson says, take your blood pressure medication before you go to the doctor's office to avoid wasting both of our time. Take your medication before you go to the doctor's office. And your blood pressure medication so that you don't waste our time. Because your blood pressure be high because you ain't took the medication. Hi, Felicia. What doctors want you to know but may not tell you. I have another doctor that says ethics, benzo, opioid dependence. Insomnia, anxiety is usually worse during the time of recovery because the brain will learn to adapt over time to the increasing presence of a highly sedating substance to keep you alive and functional. Recovery is difficult because the issues that led to your addiction are compounded by the aftermath. Cocaine and amphetamine, a similar thing. It's common for ADHD and memory issues to become significantly worse than before. That's what this doctor, and I assume that she is a pain specialist or a psychiatrist, says she wants you to know that recovery is very difficult when you are addicted to opioid sedatives, cocaine, amphetamines, and all of that. I am wrapping this up. I have had a ball on this Facebook Live. And, you know, I like to do things that are funny, and I like to make it and keep it real. I want to end with this, and this is what Dr. Sharon wants you to know, wants every patient to know and every patient to do. And I am going to tell you, because I tell you all over the country, I usually, if I'm talking to patient groups, I say this. Number one, these are 3 questions that you should make sure you should never leave the dentist's office, the doctor's office, your toenail office, podiatrist's office, nobody. You should never, ever have an encounter. And a lot of doctors said, don't come in here with 20 questions. That's cool. But you should never have a question. You should never not have these things answered at the doctor's office. Number one, what is my main problem, doc? And have it in a way that you understand. 2, why is that important? 3, what should I do about it? Okay, this has been a very long Facebook Live, but this has been hilarious. Thank you so much for joining me. Do share. It's long. I'm going to repost it, but this has been hilarious and it's been fun. Thank you to my doctors that have been online. They still chiming in. They want y'all to know a lot. I'm going to have to do a part 2 on this. I'm going to have to do a part 2 because doctors want you to know some stuff and they want to do it behind the veil, and some of them just want you to know and they don't care who tells you. But ask me 3 is the last tip I gave you. Doc, what's my main problem? 2, why is it important? And 3, what should I do about it? Thank you. Have a happy, healthy day. Thank you for joining me. I will post this. Repost it, please, on your sites. Thank you, Felicia. You have a blessed day, too. This is Dr. Sharon. Check me out on Facebook, Twitter, Instagram, everywhere. I'm tired. Bye-bye.